Thank you for joining us for this COVID-19 live town hall weekly update, Your Health and Safely Reopening Our Economy. My name is Erica, and I'll be your host tonight. We'll be taking as many of your questions as we can on this live event. If you have a question, you can press *3 on your phone keypad at any time, and you'll be placed in line to speak with a member of our staff. They'll take down your name and where you're calling from, and the next time you hear your name, you'll be live on the call, and you'll be able to ask your question directly, or if you're watching online, you can send your question through the website. We would like to first set the stage for tonight's discussion. Douglas County began a phased-in reopening of its economy beginning April 27th, consistent with Governor Polis's statewide new safer-at-home orders that began that day. Since then, your Douglas County Commissioners have been working with the local business community and your Tri-County Health Department and many other community leaders on plans toward a goal to safely, responsibly, and lawfully reopen our economy. Tonight, your county commissioners will take your questions and provide you with updates on exactly what is being done to move forward on that goal. And speaking of being safe, we encourage everyone to continue demonstrating the public health recommendations found in the state orders, including following social distancing guidelines, frequent hand washing, and especially if you're over the age of 65 or you have chronic health issues, staying at home as much as possible to avoid possible exposure to COVID-19. Your Douglas County Commissioners, Roger Partridge, Laura Thomas, and Abe Layden, are joining us live video, while Dr. John Douglas and Melissa Sager from Tri-County Health will join us on the phone tonight. You can watch and listen at douglas.co.us/townhall. If you are just now joining us, to ask a question, you can press *3 on your telephone keypad, and or you can send your question directly through the website. Now, let's kick this off by going right to some questions for you, the commissioners. It looks like we already have an online question, and Jackie wants to know, and this will go to Tri-County Health Department. Jackie would like to know, what about gatherings at our home? Do those still need to be limited to 10 people? Tri-County, go ahead and whoever wants to take that.
Melissa, I'll defer to you.
Okay, great. Yes, gatherings of 10 or less can happen at your home. They are still subject. All public and private gatherings are subject to that 10-person limit. Tri-County has actually put up some guidance on our website about what small gatherings can look like. Taking some practical precautions in those spaces to limit the number of shared items and close contact. So bring your own chair, bring your own picnic, keep your 6-foot distance, make fun signs to remind folks. But one of the biggest things in that space that's much different than what we're used to is to have a plan in place and to communicate that plan out to your friends and family that may be visiting. And it sounds really silly to do that, but so everyone's aware of what precautions are in place. Bring your mask, we'll have signs, bring your own food, but really connecting with your close friends and family when you're putting that on to communicate that plan out.
Great, thank you, Melissa. And let's go to our next question. We have Brad in Highlands Ranch, and he has a question for Dr. Douglas. Brad, you're live. Go ahead and ask your question.
Thank you, Dr. Douglas. Just had a question about probable cases. I would like to know how many in Douglas County were part of the probable case count and death count in Douglas County, and also would like to know, when it came to the death toll in Douglas County, how many of the deaths had anything other than COVID-19 listed first, from pneumonia to heart attack to anything prior or anything other than COVID-19?
Brad, thanks for the question. I don't have precise answers for you. We've been taking our death data from the state website. The state website is in the process of being modified to reflect what you're referring to, which are causes of death in people who had COVID. That's a larger number. That's required by the Centers for Disease Control for surveillance purposes. And then the deaths that are due to COVID, those are the ones on the death certificate. So I don't have the totals in front of me right now, but we will be reflecting both as soon as we can get them from the State Health Department. Regarding the cases, I also, I'm sorry to say, don't have the breakdown by probable versus confirmed. The vast majority of the cases that we are in either category are confirmed by viral RNA testing. I suspect that's true for Douglas County. I don't have that answer tonight for you. I'm sorry.
Thank you, Dr. Douglas. And now we're going to go ahead and move to our commissioners being able to talk about what's going on with our pools and et cetera. So we'd like you to share your response to these questions because we've been getting a lot of questions that are already coming in. People are asking about pools, event venues, and graduation. So Commissioner Thomas, let's go ahead and hear from you first.
Thank you, Erica, and I'd like to welcome everybody who's on the call this evening. So we've had lots of phone calls and questions about pretty similar things. When the Safer at Home orders went in place on April 27th, there was a process involved in that order that allowed counties to ask for a variance to include more items. Douglas County has had 2 successful variances approved, one for Park Meadows Mall, churches, gyms, and restaurants. Now, we have other items that our staff are starting to work on variances for, and we'll tell you what those are. The first one are social venues, places where weddings and large gatherings are held for events at event centers. Of course, in our parks, there's picnic tables and pavilions, soccer fields, playing fields, ball diamonds, and the one we get a lot of questions about is gathering size. We're at 10. How much longer do we have to be at 10? When can we go to 25 and 100 and 250? So those are a group that we are working on variances now. And I'd like to now turn this over to my fellow commissioner, Abe Layden.
Thank you, Commissioner Thomas, and we certainly appreciate the question. As we address this dual crisis, we realize that the economic piece is really so significant. And Commissioner Thomas is exactly right that we've been working very hard as a board. Certainly, we were the first area in the metro area to begin opening up on April 27th. So we're moving forward rapidly, and based upon the epidemiology of transmission that we're understanding from the experts, pools have a very limited likelihood of transmission when it comes to this particular virus. And I'll certainly let Tri-County Health speak more in depth to that. But no doubt looking to move forward with variance applications for pools, youth sports, graduations, and playgrounds. We have a great partnership with a number of other jurisdictions, elected leaders, and districts in and around Douglas County, and certainly the school district is a wonderful partner. I know they're working very hard on a potential variance or how graduations might look in Douglas County, and so I'm really thankful that this board has moved forward to honor all of the amazing seniors in Douglas County that have worked so hard over the last 4 years. So we think it's important that they are honored, and based upon these declining marginal rates of deaths and hospitalizations in Douglas County, that an in-person graduation certainly makes sense.
Wonderful, thank you. And now let's go to Commissioner Partridge.
Unmute there. Thank you, Erica. Thank you, Commissioner Thomas, Commissioner Layden. And as we know, wonderful things have happened in Douglas County because of the great response we've had from residents, not only being attentive to the orders, but also being very cautious themselves. And with that, we've been able to move forward, as Commissioner Layden mentioned. We are looking at the variances, as they both have mentioned, but another one I will add on to there is the fair. We know it's a great community event. There are many involved in the community in it directly, and certainly we know the children who, with their animals, are very interested to see what kind of things they'll be able to do. So being that it is the biggest county event that we put on through the year, we're very interested to pursue a variance on the county fair, knowing there's a lot of challenges with it, but we've got to start somewhere.
Wonderful. Thank you, Commissioner Partridge. And thank you, commissioners, for that update. I just want to remind everyone again that we would like to answer as many questions as possible this evening. So if you would like to ask a question, press *3 on your phone to get into the queue, or you can send your question through the website at douglas.co.us/townhall. Okay, next let's go to an online question. This is Esteban, and his question is for the commissioners. And Dr. Douglas, if you would like to add to this as well, you are welcome. Esteban says, first of all, thank you everyone for continuing with a commitment to keep all of us informed. But he's saying, as you pay attention to infections during this first phase of opening up, what would cause the county to return to prior restrictions? And any commissioner that would like to take that question, go ahead. Dr. Douglas, would you like to respond to that one?
Yeah, sure. Good question. Basically, we look at a couple of different parameters. Part of it are epidemiologic parameters. Do we have rising cases? This is looking at the number of cases rising over a 14-day period. A somewhat lagging indicator, but probably even more important, is rising hospitalizations. Do hospitalizations rise more than a certain percent over a 2-week period of time? And then lastly, do we have any problems or concerns about hospital capacity to deal with a surge of infections? Right now, all of those parameters look great for Douglas County, and that's why the thoughtful and I think really quite methodical gradual opening, doing it safely, keeping an eye on both the hospital situation as well as the community situation has been so important. If I might, I just got a text from our head epidemiologist, and I wanted to clarify in earlier questions. All of the cases that have been reported in Douglas County so far are confirmed cases, not probable cases. So sorry I didn't have that earlier.
All right, thank you. And next we're going to go to a live question. We have Melissa in Castle Rock. Melissa, you are live, and she has a question for Dr. Douglas. Go ahead.
Yes, my question is about the suggestion of wearing masks, and I'm particularly concerned if children are required to wear them in settings for 6 or 7 hours a day, because I'm looking here, this is at a 2015 study that using cloth masks can actually put people at an increased risk of respiratory illness and viral infections. So I'm a little concerned about that it's healthy to wear them long periods of time.
So thanks for that question. It's an important one because how to best and most safely reopen our schools is a topic, as the commissioners have already said, of great discussion. There are clearly advantages to wearing masks. We know based on laboratory aerodynamic studies that it can prevent respiratory droplet particle dispersion by anywhere from 50 to 90%. And we think that given that somewhere between 25 and 40% of all persons with infection don't know they have it, they're asymptomatic, and that rate is actually even higher than children. There are, I think, really clear advantages to wearing masks. Now, is 6 to 7 hours a day too much? And are there people for whom it may present problems? The answer is probably yes to both. I haven't seen the study you've referenced, although I just spent an hour on the phone this afternoon with superintendents across all 3 of our counties, including Douglas County, and that very question came up. What is, if we have face coverings for teachers or kids, what's the right duration? How long should they wear them? So they're very carefully looking at that question. I think the respiratory infection acquisition piece is not data that I'm aware of. It is something we'll be looking into. But I want to acknowledge that this is I think, an important prevention measure, but we want to use it in the right dose in the right places.
Great, thank you, Doctor. Next we have Emil, and he has a question for Commissioner Thomas. Emil, you are live. Go ahead and ask your question.
Hi, it's Emil, and thank you, Commissioner Thomas,
for taking the
question. My question is regarding the limitation on church attendance at 10, and when there's going to be some reasonable variances based on social distancing and what churches are doing to accommodate larger attendance in a safe manner. And if that's not something that's imminent, what's the data that's supporting that we continue a lockdown and think it's so unsafe for people to worship in churches in Douglas County? And then the follow-on question to that is, has there already been a variance requested for that?
Emil, I'd like to thank you for that question. And yes, churches are one of the variances that Douglas County received last Friday evening. And that variance is available on our website. If you go to douglas.co.us, there's a COVID-19 page, and you can download the variance right there. We worked with churches to get that variance done, and it's very thoughtful. A family unit can sit together, and then there needs to be 6 feet, perhaps 3 seats between that family unit, and then another family unit can be seated. The row behind that group is empty, and then there will be another group that keeps social distancing, but we can get more people into our churches. And I think of all the things that we've accomplished with our variances last week, the churches were the ones that were most important to me. I was able to get a ticket to go to my church on Sunday. There were 12 rows between us and the next people. It was a huge church that can seat 1,000 people, and there were less than 20 in there. So that's why I don't go to a church in Douglas County, but Douglas County has been very fortunate to have had our variance approved by Dr. Douglas and then the state health department. So go to our website and you can see what all you can do in Douglas County when it comes to worshiping. So Emil, thank you so much for that question.
All right, thank you, Commissioner. And now, Dr. Douglas, will you share a quick update from Tri-County Health Department? Go ahead.
Yeah, happy to do that. As has already been alluded to by several of our commissioners, Douglas County's response to the epidemic has been, I think, really best in class, both in terms of citizens' response to the various public health distancing orders. Those were painful. The stay-at-home time period where, our social movement was severely restricted, as well as even the current time. We've already had questions about things that we'd like to see open. And I really want to thank the commissioners and the residents of the county for being so supportive and cooperative with the measures. The result has been very impressive. Douglas County's had a substantial decline in cases, which continue to be low, a substantial decline in hospitalizations, which also continue to be low, and finally a substantial decline in deaths, somewhat related to the question that was asked earlier. So all those parameters are incredibly impressive and really, I think, create an opportunity for Douglas County to be able to envision more of the kind of opening that has been discussed earlier on the call today. I will say that we monitor these things because, as one of the questioners asked, we want to be sure that if things revert or we have outbreaks or things get worse, we're on top of it. And I've got a team that's monitoring the data every day. That's why they could tell me the number of confirmed cases so rapidly. And we're really doing our best to be as vigilant about that as possible. Part of our strategies for opening back up are going to involve two things that have probably been somewhat underemphasized in the last couple of months or so. One is testing. A month and a half ago, we had very limited testing capacity. We could really only test very sick people, hospital workers, folks that were actually hospitalized. And part of the message to the public was, if you're sick, and you have COVID-like symptoms of cough, shortness of breath, fever, chills, loss of smell actually was a recently identified one. You might have COVID. You should act like you have COVID and stay away from other people, but don't go to your doctor and try to get tested because we don't have enough testing capacity. That was a real limitation. It really limited our understanding how much disease was actually present in the community, and it limited our ability to figure out who had actually been exposed to infection. Things have really improved fairly substantially, in the last several weeks. We believe that in Douglas County, we are close to having capacity to pretty much test anyone who is symptomatic with COVID-like symptoms. This can be done in a variety of different places around the county. Our website lists specific locations in Douglas County, that website being www.tchd.org/coronavirus. And if you go to the testing link, you can see a variety of different places around the county that you can be tested. I also want to announce that there's a regional testing capacity opportunity now that opened in Denver at the Pepsi Center about a week ago. This is open 7 days a week, 8 to 4. It's free. You don't need a doctor's order to go there. You simply have to fill out an online registration. So if it is for some reason more convenient for you, if you work in Denver, for example, to be tested there and you're either feeling sick and may have COVID, or if you've been exposed to someone with COVID, that's a terrific opportunity to expand our testing horizon. The other thing that we're expanding now is a phenomenon or a public health technique called contact tracing. This is not new or novel to COVID. This is a technique that we've been using for infectious diseases for the past 100 years. And what it basically means is that if someone's been exposed to someone who's got an infection, we talk to the original case, we find out who they've been in contact with, and then we reach out to the people who've been exposed to give them a heads up. Hey, you could have been exposed to COVID. If you're sick, you really ought to get tested. And you ought to try to limit your contact with other people, really trying to isolate yourself from other people in case you do get sick. The value of this sort of dual opportunity, if you will, testing plus case investigation and contact notification, means that rather than a community having to do this like drastic stay-at-home thing that we did in March and April and quarantining most of us, we can now identify with more precision who's infected, who's been exposed to them, and who are the people that really need to stay home. The last things I wanted to point out as we move forward over and above the issue of face coverings, which again are not perfect, but we do think is an important prevention adjunct, is the issue that the people who really get sick from COVID are people that are over the age of 60 or 65 or so, or those with chronic underlying disease. And as various entities begin to open up, the churches that Commissioner Thomas talked about, the Park Meadow Mall that was referenced by Commissioner Layden, the potential events in the future, the folks who are older or those who have underlying disease are going to be most vulnerable no matter how we slice it. And those are the people that are really going to need to be most careful. If those people can be particularly careful protecting themselves, we think community transmission and the ability of the community to remain as open as possible will be optimized. Thanks very much.
Wonderful, thank you. Okay, let's go. While we have you, Dr. Douglas, here, we have a live question for you. This is from Ronald in Castle Pines. Ronald, you're live. Go ahead and ask your question.
Good evening, Commissioners in Tri-County. Thank you for taking my call. I'm a property manager for HOAs, and we have swimming pools and tennis courts. What are the regulations or restrictions on opening those amenities?
Ronald, this is Dr. Douglas, and I'm actually going to do a transfer to my colleague Melissa, since she's heading our team that's overseeing guidance about those topics. Thank you.
Definitely, I'd be happy to answer that. It's a question we're getting a lot. Pools within these facilities have to be closed under the current order, but we do expect updated guidance on those on June 1st. As far as the other facilities like tennis courts and basketball courts, those facilities can be open. What we've asked our local folks to do is to keep an eye on those spaces. If social distancing is tough to adhere to in those spaces within the community that you live in, we'd ask that those facilities continue to be closed, or signage reminding folks to keep their distance and wear masks. Tennis and basketball is recommended for singles only or members of your household.
Wonderful, thank you. All right, our next question is Marilyn, and she is in Lone Tree. She has a question for Dr. Douglas. Marilyn, go ahead and ask your question live. Marilyn, can you hear us?
Yes.
Okay,
yes.
Perfect. Go ahead and ask your question.
Okay. We are older. We both have immune diseases. We have stayed in all this time, and then if we've ever gone out, we've worn masks. There are so many people that don't wear masks, and it really upsets us. It's like the ones that were in, I don't know if it was Alabama or where they all gathered together and nobody was wearing masks. Care about themselves. If they cared about themselves, they would wear a mask, but they don't. And this is, I think, very, very dangerous. So also, I wanted to know about restaurants. I know that probably the safest place in restaurants are the ones that have patios outside, in that they would be less likely to be a problem. But what about the ones that you have to sit inside? So that's my question.
Well, Marilyn, thank you for that. First of all, I appreciate your concern about other folks wearing masks given your medical issue. And frankly, we do think it's something that is a sign of community support. It can protect the people who are wearing it, but it protects other people like you, for example, even more. And we are quite interested in spreading the word and having as many people as possible adopt that practice. I will say you're correct about restaurants. The safest place is the patio. Douglas County was successful, as Commissioner Thomas mentioned, in receiving a variance for restaurants. Those guidelines went into effect over the weekend. I think they're really solidly thought through guidelines. And if the restaurant is complying with the guidelines in terms of spacing out tables, limiting the size of parties, asking folks who come in to wear a mask until they get to their table and begin to enjoy their food, and then to wear it again when they're leaving, and to be sure that their staff are practicing good hygiene as well, which includes hand washing and masking. I think being inside can be quite safe. Probably not as safe as being outside. And if it's a nice day, and if I was you, I would probably choose that. But if it's raining and you want to be in a restaurant, just be attentive to the circumstances. If it looks like good practices are being observed, I think you can confidently enjoy your meal there.
Wonderful, thank you. Let's go to Steve in Castle Rock. He has a question for Melissa Sager with Tri-County. Steve, you're live. Go ahead and ask your question.
Yes. Excuse me. Thank you for taking my question. My question is this. I have a friend who has been out of state in Michigan for at least 2 months now, and she is returning home shortly. She will be bringing her daughter with her as a traveling partner. She'll be here for a couple days. And is it necessary for themselves for them to self-quarantine themselves for a period of time when they get back here? And if so, how long should they self-quarantine themselves? Or can they safely go about their business when they get back within the rules and guidelines that the rest of the county is observing? And again,
it's a really great question. This is Melissa. I'm happy to answer that, and then I'll turn it over to Dr. Douglas, who may be able to add more. But it depends. If they're coming from an area with a high transmission rate, if they've had contact with a positive person, if they've been really strictly adhering to social distancing in the community they're coming from. But what we're really looking for are these triggers: contact with a person coming from a high transmission area, and very closely monitoring for symptoms if they've had contact. Actually, you know what? With that, I'll turn it over to you, Dr. Douglas.
You're doing a great job, Melissa. That's more or less what I would say. If they haven't had a known exposure and they're not coming from a known hotspot, I mean, if they stopped and visited for a couple of days at a meatpacking plant in South Dakota, for example, where there are outbreaks going on, I'd be a little more concerned. But otherwise, I think, as you put it, is the way I would advise them. They can follow the regs of Douglas County, which is still not completely opened up, but it's certainly getting there. And just be careful, when they go out, practice social distancing. Again, I would suggest wearing face coverings in public places. But if they haven't had a known contact, I don't think any particular precautions would be needed.
Wonderful, thank you. Our next question is for you, Dr. Douglas. This is Jinx in Highlands Ranch. Jinx, you are live. You can go ahead and ask your question.
Yes, I would like to know how many people, do doctors, do politicians, do any of them know how many of these people that are dying in hospitals and in nursing homes, just because they have coronavirus, they may not be dying from that. They may be dying from the fear, from the loneliness, from not being able to have contact with the people they love and who love them. And we all already know that nursing homes are lousy on the best day they're in operation. I just lost my mother April the 20th in a Douglas County nursing home. She was starved and dehydrated to death. And their response to us looking through a window, and I am a nurse, was to close the blinds so we couldn't see it. And I'd like to know what the state does, what Tri-County Health does, what protections are being put in place to prevent these people from being abused to death, neglected, and ignored.
So, James, this is a really, I'm sorry, you finished? This is a really important question. Nursing homes have come under the spotlight not just in Douglas County and Colorado, but across the country. They have had a number of problems. Many of them have had less than ideal infection control protocols in place. Frankly, the staff in many of the facilities are not among the most highly paid medical staff. Personal protective equipment for the staff has been limited. And as you said, when COVID came and visitors were limited or frankly just prevented from coming at all, that watchful eye of the family, which not only provides that emotional support that's so critical, but also is able to say, wait a minute, this isn't clean, or my mom's not getting the right kind of food, or she's allergic to this, has not been adequate. I will say that the State Department of Health facilities that oversees and licenses nursing facilities has really upped its game. The governor has created a long-term care facility task force to oversee both overall quality of care in nursing homes and long-term care facilities, as well as COVID-related prevention. And most health departments, such as ours, have set up long-term care facility outbreak response teams. So I think things have definitely gotten better. They are absolutely not perfect. And I think one of the legacies of what we've seen, both in Colorado as well as nationally, is going to be to take a harder look at how we can deliver more effective care in those facilities.
Great. Thank you, Dr. Douglas. And we are about halfway through our live town hall discussion about your health and safely reopening our local economy. We have a lot of questions coming in, and we would like to hear from you. So if you would like to ask a question, press *3 on your phone, and you can get into the queue, or you can send your question through the website at douglas.co.us/townhall. Now, Commissioner Layden, can you share an update on what I hear is a very important community event next week, just for older adults and their families and caregivers in Douglas County? Commissioner, go ahead. Commissioner Layden, can you hear us?
There we go. Is that okay? Can you hear me okay?
Yeah, I can hear you fine now.
Okay, good. Thank you, Erica. I appreciate that question. I think it's an important one. Let me just step back for a moment and really reiterate for the listening audience our variance process as a county, as policymakers and elected officials working on behalf of the citizens. No doubt the public health issue is certainly significant, but for us, in order to even apply for a variance, we had to have a suppression plan in place, sign off from the hospitals, sign off from Tri-County Health in order to submit that variance. And our staff has done a phenomenal job of really cobbling together all of those critical pieces in order to get that across the finish line. So I just want to reiterate that it's certainly a process. And there was a question about suppression. I think we're also polite to each other. The three of us have a hard time hitting that mute button to come on. Certainly I do. But, part of that suppression plan is just making sure that, there's not a 20% increase in positive cases in a 3-day rolling average over a 14-day period, no more than 100 new cases per 100,000 people in 2 weeks, not a substantial increase in hospitalizations directly related to COVID-19 over a 2-week period, or the inability of Tri-County Health to contact trace new cases within 24 hours of a known positive test result. And certainly that varies a bit, and I appreciate Dr. Douglas and Melissa providing some specificity on that level. But no, we do have a phenomenal event coming up on Friday, and we know from data and experience that COVID-19 presents a much greater risk for older adults, for vulnerable populations, and we know that residents in that population group have specific questions, specific concerns that need to be addressed with regard to their health and reopening the economy. So that's why this Friday, May 29th, from 10 to 11 a.m., we're dedicating an additional hour to answering questions from older adults and their families or caregivers. So this live town hall is going to be presented just as these weekly updates are online and by phone with closed captioning available. So in addition to my fellow commissioners, we will again be joined by Dr. Douglas, and we'll also hear from Carrie Erickson, who is the Executive Director of Aging Resources of Douglas County. So to find out more about this event that's especially for our seniors in Douglas County, please visit douglas.co.us/town hall. And if you need information on services and resources available for older adults more urgently, please contact the Aging Resources of Douglas County call center at 303-814-4300. Thank you, Erica.
Thank you, Commissioner. Let's go to our next live question. We have Kim in Castle Rock, and she has a question for Commissioner Partridge. Kim, go ahead. You are live. You can ask your question.
I was calling to see when the gyms would be opening in Castle Rock, and then once they open, like, for example, Planet Fitness that has other things besides equipment like the tanning beds, massage chair, and the water table, will we also be able to use those items too?
Kim, thank you. And I know Commissioner Thomas she has had the best answers to this, and I want you to have the best answer. So I'm going to turn this over to Commissioner Thomas.
Thank you. And so we all know that we're ready to go back to our gyms. I've got a COVID-19, a COVID plus 20 that I need to deal with. So I actually really understand what you're talking about. But I'm going to punt this back to Melissa because there are so many different ins and outs as far as percentage and numbers that I don't want to say the wrong thing. So Melissa, would you mind taking this, please?
Yeah, not at all, and I'd be happy to. So gyms, as you've heard, I'm sure, on these calls, are a bit riskier of a setting when we're talking about gradual reopening. Lots of shared surfaces and hard to maintain distance with all the movement that happens there. Under the statewide order, personal training in gym settings with 4 people or less is permitted. Douglas County actually obtained a variance, as the commissioners have mentioned. And so in Douglas County, it looks a bit different in the gym settings. Classes and personal training in groups of up to 10 individuals, and then a breakdown in the gym setting by capacity at 50% capacity in those spaces. There are a variety of requirements still in place, and one of those is saunas, steam rooms, locker rooms. Those shared spaces need to continue to be closed. As far as some of that shared equipment, there's strict disinfecting protocols that need to be in place, and it would depend if those can be used independently versus a sauna or steam room that you're around other people. We do anticipate additional guidance still coming from the state as we begin a gradual reopening, and so we encourage you to keep an eye on Tri-County's website and the state's website for updates on those facilities.
Wonderful. Thank you, Melissa. Next, we're going to go to an online question. This is Norma, and her question is for Commissioner Partridge. She says, how much emphasis is being placed on opening up Douglas County for economy purposes? There's been a great amount on health. However, I disagree that there have been considerations on the small business community, restaurants, and bars. Commissioner Partridge, go ahead.
Thank you for that. This has been a concern right from the get-go for your commissioners and Tri-County Health, as we call it, the unintended consequences. As we know, certainly you pay attention to the virus, but the issues of the economy, the unemployment, their health conditions that individuals were not taken care of and still not taken care of, that were addressed. But we know the economy is one of the things that hits people more direct than anything. We know that with less income, that is certainly a stressor on an individual. We don't want to see any increase in mental challenges or family disturbances because of finances. So economy and personal income has been a high priority for us to be attentive to. And I really want to point out that Tri-County Health has been wonderful with that. And I really believe the state has attended to our variances as we have put that, made it an emphasis in our variances that personal income and the economic conditions really challenge individuals. So our variances have been very attentive to those also.
Wonderful, thank you. Our next question is an online question for Commissioner Layden. It says, some of the guidelines for businesses in the approved variance requests are different than those the state has in place. Can Douglas County businesses still follow the Douglas County guidelines? Commissioner Layden, go ahead.
Thank you, Erica. And that's a wonderful question. Certainly the process changes day by day, if not hour by hour. So appreciate the patience that the businesses have had in terms of dealing with all of the changes. But with regard to the specific guidelines, the state orders control. Certainly local jurisdictions can be more restrictive, but not less restrictive. So the more restrictive guidelines, according to Colorado law, are going to prevail.
Wonderful. Thank you, Commissioner. Next, let's go to Michael. Michael, you are live and you have a question for Melissa Sager with Tri-County Health. Michael, go ahead and ask your question.
Yes, I live in Parker, Colorado, and we live in a nice subdivision with this, a pool. The pool's out in the middle. There's a lot of sun, a lot of chlorine. Are the pools going to be opening here in Parker pretty soon in the neighborhoods, or do you know?
It's a really great question and one that we know is on everyone's minds. We're working on this gradual reopening and trying to address a very diverse group of businesses and activities. Pools are one of them. As Commissioner Thomas and Commissioner Layden mentioned earlier, Douglas County is seeking a variance and has begun the discussions about what a variance for pools can and should look like from the state's order. But until a variance is obtained by Douglas County, the Safer at Home order indicates that pools are currently closed. We do expect additional guidance from the state on June 1st. The current Safer at Home order expires on June 1st, and the state has indicated that they will be replacing that order with an updated order along with additional guidance for pools is one of the major ones, but also for other outdoor activity and outdoor activity businesses, youth sports, and updated guidance for places of worship. So it's front and center on a lot of folks' minds of how we get everyone out and active. We know how important it is, and so pools are at the top of that list, so keep an eye out on June 1st.
Wonderful, thank you. And our next question is an online question for Commissioner Thomas. And the question is, I've been hearing a lot about the mental health impact of the COVID-19 crisis on individuals. So how is the county responding to that? Commissioner Thomas, go ahead.
Yeah, this is a really real question. My nephew's close friend took his life 3 weeks ago, and my nephew has said it was because of the social distancing that his friend Chris just couldn't deal with. So we know that this question is real. Douglas County, since 2017, has had now 4 co-responder teams in place. This is a specially trained law enforcement officer and a PhD, a PhD level clinician. So this team can respond to a call from someone who's just needing some help to get through a crisis. And this team is trained to talk with a person on the scene. In a majority of cases, they're able to calm them down and get them into some kind of further treatment because, hey, we all need help, right? There are cases where the team can transport someone to an inpatient therapy center, but nobody has ever been jailed or taken to a hospital for treatment. So Douglas County realizes that mental health care is a necessity, and we take care of that through the county funding that the commissioners provide. So if you're out there and you are struggling, know that you're not alone. There is help and there is hope. And just give the Sheriff's Department a call and you can get some help that's free to you. So thank you. That's a great question.
Wonderful. Thank you, Commissioner Thomas. Next, we just want to do a poll question. We'd like to make sure you guys stay informed about what's happening in Douglas County. So if you would like to continue to receive information from the county, please press 1 on your phone now. Again, that's please press 1 on your phone now if you would like to receive information from the county. Okay, next we're going to go to an online question from Fritz. And this question is for Melissa Sager with Tri-County. Fritz wants to know, what is your stance on forced electronic contact tracing and its constitutional, and I'm not sure what the last word is here. But if you'll take that on electronic contact tracing. Melissa, go ahead.
Yeah, that's a really important question, and I'll defer to Dr. Douglas, who can speak to how we have used some contact data to inform our conversations around what we can put in place to ensure safety. But I'll leave that to Dr. Douglas.
I don't think Dr. Douglas is on the call any longer. We can go ahead and go to the next question, though, if you don't want to answer that one.
Well, I'm happy to chat through it. It has come up, and it's a discussion. When we talk about using information like that in data, we are always very cognizant about privacy. We know how important that is. And so as we use this data, it's something that we're aware of. We use data that's available voluntarily through many of the callers on this call when we use Google Maps, or we check Google to see if a restaurant is busy. And so we've used some of that data to see, are people still moving? That data is completely de-identified. Some of the data that we're considering that public health in general is exploring is when your phone that you have on you a lot of the time is being used by you, if we have de-identified data that could automatically send you an alert if you have had contact in a risky area or been close to someone who's infected. We're considering how we could use that to improve health, again, with data that's being collected and completely private as something that we know is very important. So.
Great. Thank you so much for answering that. And Fritz actually has a second question he'd like to ask. And he says, what about farmers markets? Some businesses and the general public depend on these markets for not just food, but other consumer products. So when do we expect them to be allowed, and what rules are going to be in place?
Yes, fantastic question. Farmers markets are allowed under the current order. Tri-County has guidance on our website specifically for the operation of farmers markets for just the reasons that you described. We know our community uses these. It provides great access to fresh fruits and vegetables. And so we've paid special attention to make sure that this guidance is up on the website. So farmers markets are permitted. I'd encourage you to check out the requirements of how to keep those safe. And yeah, definitely visit your local farmers market and stay safe.
Great, wonderful. We have another online question, and this one's for Commissioner Layden. Travis would like to know, the county is doing a lot to open for general population, but what about our older adults as the vulnerable population? We are still asking them to be isolated, and they are already very isolated. We have got to find ways to get them back into the community. Commissioner Layden, go ahead.
Well, thank you so much for that question and for sharing that, Erica. Travis, look, we realize that our older populations are certainly struggling because this is a dual crisis. This isn't just about containing coronavirus. It's about all those secondary effects, whether it's mental health, substance abuse, domestic violence, or jobless claims. We know that the impact is significant. And as Commissioner Thomas shared, the mental health of our citizens and certainly our seniors is significant. So I just want to reiterate that part of what we are doing in Douglas County is encouraging personal responsibility. And if you are an older adult that maybe has a chronic underlying condition, we think it's important that as a free citizen, you make that decision whether or not it's important for you to get out, to connect, to perhaps see a family member at a distance, or to stay at home. But that's a personal decision based on personal health issues. And so we continue to encourage that philosophy. But no doubt, the connection to others is really significant. So I just want to share with you, if you are in crisis right now, you can call Colorado Crisis Services at 1-844-493-8255. And if you prefer to text, you can text TALK, T-A-L-K, to 38255. Again, that's 38255. Thank you, Erica.
Of course. Next, we have a live question from Kenneth in Highlands Ranch for Tri-County Health. Kenneth, go ahead. You're live.
Thanks so much. I actually don't have a question. I just had a comment to share. I wanted to express my appreciation for Tri-County Health and Douglas County and basically the work that has been done during this pandemic. Seems like criticism has popped up from different places, and I can't figure out why, because all I see is that you guys are working day and night, it seems like, on our behalf, particularly with frequent communications just like these forums and other ways. So my thanks to the leadership of Tri-County Public Health, for the commissioners, and just appreciate you keeping up this work on our behalf. We see our tax dollars being put to good use, and we see a little bit of light at the end of the tunnel. So thank you.
Thank you so much for that comment. And just know that from Tri-County Health, we know that this is confusing and frustrating and ever-changing. And so we get that too, but we see all the folks helping in this situation. And so right back at you, thank you for supporting and adhering. And, you know, we come out on the other end of this better.
Yeah, thank you.
And this is Commissioner Partridge. And Kenneth, I hope you have a twin or a triplet. We really appreciate those kind of comments. And, you know, we're so blessed in Douglas County to have the wonderful residents we do, very informed, very educated. And we, the commissioners, we Tri-County Health, and I think all the municipalities and the staff, we have that desire to serve you and to help you. So we appreciate the recognition, but you know what? We do it because we care, and we are residents here too. Thank you very much, Kenneth.
Thank you.
Wonderful. Thank you, Kenneth. And just a final reminder, if your question was not answered tonight, we encourage you to visit douglas.co.us/citizenconnect to submit your question, and we will respond. Be sure to join us again next week on Wednesday, June 3rd for additional updates on our economic reopening, and also this Friday, May 29th at 10 o'clock a.m. to hear about resources for older adults and what's important to keep you safe. Now, before we conclude our live town hall, we'd like to give your Douglas County Commissioners a few moments for final comments. Abe Layden, our Douglas County Commissioner, would you go first, please?
Thank you, everyone, for joining us tonight. You know, it's often been said that tough times don't last, tough people do. And Douglas County, you are tough, you are resilient, and you have demonstrated your ability to get through this incredible challenge in our lifetime. And we really thank you for that on behalf of Douglas County. I have to really thank all of our municipal partners as well: Lone Tree, Parker, Castle Rock, Larkspur, Highlands Ranch, all of the wonderful cities and towns in Douglas County. We wouldn't be able to do it without you. Look, we've been working very hard to open gyms, restaurants, churches, and retail. We're going to continue to work hard to open as long as it's safe to do so, and the numbers are showing that. So whether it's theaters, bowling alleys, libraries, playgrounds, pools, team sports, graduations, or even larger gathering sizes, we're out there working hard to make sure that we can get back to normal. But in the meantime, stay well and stay safe out there.
Wonderful. Thank you, Abe. And next, let's go to Commissioner Laura Thomas.
Thank you, Erica. I'd like to touch on something that Kenneth asked about, that there are some people who are upset. And I think that comes from fear. People don't understand how low our cases are in Douglas County. It's my understanding in the last 3 days, we have had no hospitalizations, and we have had 4 new cases. That's it in all of Douglas County. And this is with us being safer at home with more freedom for over 4 weeks. I think people have learned what they need to do, how to be safe, and people are resilient. And I applaud everybody who has taken time to listen to this call tonight, because what you're doing is educating yourself. And when you educate yourself, then there's no reason to be fearful. There's no reason to be afraid anymore. And we just need to understand the people who are most at risk are the older population. My mother is 87 years old. She is in her apartment, and she doesn't even let us come visit her because she knows she needs to stay there and be safer now. So it goes back to this personal responsibility we've talked about. I'd like to thank all of you for listening tonight and just say good night and God bless. Thank you.
Wonderful. Thank you, Commissioner Thomas. And now let's go to Commissioner Partridge.
Thank you, Erica, and I will echo Commissioner Thomas. Thank you for everyone who's listened this evening and on all of our town halls. We really appreciate you. I want to give a shout out also to Dr. Douglas and Melissa for joining us and providing their expertise and working alongside we and the residents of Douglas County. to keep us moving forward. And these questions tonight certainly lets us know there's a lot of information that you still seek. And it encourages us, we the commissioners and all of us working on this, to keep moving forward to see what can we do, what can be done to help you, the residents, you, the employees, you, the businesses, to be able to get back to as near normal as possible. Knowing we have never seen anything like this before, I'm just amazed at the innovation, at the resilience, and the determination that individuals have to say, we can keep moving forward. We are blessed in many ways, and you all prove it to us tonight that what is being done is important and makes us certainly have that desire to keep moving on. As was mentioned, we are looking already for the variances for many other avenues, and important for all of you. We know there's some that are out there that are very sensitive. We encourage those that are somewhat sensitive to this, take those precautions. And if you know of anyone that shows symptoms, I was just hearing from a nurse today that when somebody does show symptoms, it hits them hard. So please encourage anyone who is showing symptoms, is sick, to seek medical advice. Don't wait. But for those who are healthy, we thank you for helping our businesses return, helping us get back to normal, and we will keep working hard for you. Thank you, everyone, and blessings to you and your family.
Thank you so much, Commissioner Partridge. On behalf of Douglas County and the Tri-County Health Department, thank you for sharing your evening with us. We hope you'll join us again next Wednesday for the Your Health and Safely Reopening Our Economy update, and also this Friday, May 29th, for COVID-19 and older adults. Be well, be blessed, and good night.